listeners, and welcome back to Everyday Health Stories, the podcast where we explore the fascinating world of medical science through the power of storytelling. Today, we're talking about something as simple as breathing and how it can actually help manage blood pressure. Sounds too good to be true, right? But it's not. There's real science behind this, and I can't wait to dive in.
That's right, Anna. Breathing, something we all do without even thinking, can actually have profound effects on our health. And when done intentionally, it can become a powerful tool, especially for managing something as widespread as hypertension.
Yeah, I read that a study from the University of Colorado Boulder showed that just 5 minutes a day of a specific breathing technique, using a device no less, could drop blood pressure by about 9 points. That's like medication level results, isn't it?
Yes, it is. That technique is called Inspiratory Muscle Strength Training, or IMST for short. And while the device adds resistance to make it more effective, it's the principle of controlled, intentional breathing that's key here. We'll get into the mechanisms behind it in a bit. It's fascinating.
Oh, I love it already. But first, a quick reminder to our listeners. Take a moment to hit pause and subscribe to the podcast. You'll get notified of new episodes, gain access to exclusive content, and join a community that's making positive changes, one story at a time.
And, as always, please remember, this podcast is for informational purposes only. It's not a substitute for professional medical advice. If you're dealing with hypertension or any health concerns, be sure to consult your healthcare provider.
Okay, so Dr. Reddy, let's set the stage. High blood pressure, it's often called the silent killer. Why is it such a big deal?
Well, Anna, hypertension puts strain on your heart and blood vessels, increasing your risk for heart attacks, strokes, and kidney disease. And what's tricky is that many people don't even realize they have it because it often doesn't cause noticeable symptoms.
Right, and I think that's what makes interventions like this so interesting. Like if something as simple as breathing exercises can make a difference, that's huge.
Absolutely. And what's exciting is how versatile these techniques are. You don't need fancy equipment to get started, though tools like the IMST device can amplify results. The focus is really on how breath control affects your nervous system.
Nervous system? Okay, now we're getting into the juicy details. So, what's happening in our bodies when we breathe deeply or intentionally?
When we breathe deeply, especially with slow, controlled exhalations, we activate the parasympathetic nervous system, sometimes called the rest and digest system. This system helps counteract the fight or flight response driven by stress, which can elevate blood pressure.
Oh, that makes so much sense. So, by slowing down our breathing, we're literally telling our bodies to calm down?
Yes, and it's not just about slowing down. Techniques like IMST actually strengthen the muscles involved in breathing, like the diaphragm, and improve the elasticity of blood vessels. That means your heart doesn't have to work as hard, and your blood pressure naturally lowers over time.
Wow, that's amazing. And I love that it's so accessible. You're not asking people to spend hours at the gym. 5 minutes a day is totally doable.
It really is. And there's more. In the next part, let's dive deeper into other techniques like pranayama and Herbert Benson's relaxation response and explore how these methods work on a physiological level.
Ooh, that sounds fascinating. Let's start with pranayama. I'm so curious. What's that all about?
Pranayama is such a beautiful practice, Anna. It's a form of controlled breathing that originates from yoga. The name itself comes from Sanskrit, prana, meaning life force, and yama, meaning control. So, it's literally the practice of controlling your life force through breath. Techniques like nadi shodhana or alternate nostril breathing are particularly effective.
Alternate nostril breathing? That sounds kind of funny. How does that work?
It might feel a bit odd at first, but it's incredibly calming. You close one nostril, inhale through the other, then switch nostrils for the exhale. It's rhythmic, intentional, and most importantly, it activates the parasympathetic nervous system. Studies have shown that practices like this can significantly reduce blood pressure by calming the mind and improving oxygen balance in the body.
That's so cool. And I've read that it's not just about relaxation, it also improves something called baroreceptor sensitivity. What's that?
Ah, yes, baroreceptors. They're like little sensors in your blood vessels that help regulate blood pressure. When you practice controlled breathing, these receptors become more responsive, meaning they can detect and adjust to changes in blood pressure more effectively. It's like fine-tuning a car's engine. You get a smoother ride.
I love that analogy. And okay, let's not forget about Herbert Benson. He's the guy who coined the term relaxation response, right?
That's right. Dr. Benson was a pioneer in mind-body medicine. He found that focusing on a repetitive word or phrase, what we might call a mantra, and pairing it with deep, slow breathing could induce a state of deep relaxation. This counteracts the stress-induced fight or flight response.
So basically, you sit quietly, breathe deeply, and say, I don't know, peace or calm.
Exactly. The word doesn't have to be special. It's just a tool to help you focus. By doing this for 10 to 20 minutes a day, Benson found that 2/3 of hypertensive patients could significantly reduce their reliance on blood pressure medications.
That's amazing. It's like giving your brain and body a break from all the chaos. And it's totally doable for most people, right?
Absolutely. The beauty of these techniques, whether it's IMST, Pranayama, or the relaxation response, is their simplicity. They don't require a big-time commitment or fancy equipment, and yet they deliver results that rival more traditional interventions.
And honestly, I think that's what makes this so exciting. It feels empowering, like, hey, I can actually do something right now to help my body. But let's get a little technical for a second. You mentioned nitric oxide earlier. What role does that play in all this?
Nitric oxide is a molecule that helps relax and widen blood vessels, improving blood flow and reducing blood pressure. Breathing techniques, especially those with prolonged exhalation, stimulate its production. It's one of the reasons why these practices have such profound cardiovascular benefits.
Oh, I love how the science ties everything together. And speaking of prolonged exhalation, I've heard that it does something special to the vagus nerve.
That's right, the vagus nerve, a superstar in the parasympathetic nervous system. When you exhale slowly, it activates the vagus nerve, which sends a signal to your body to relax. This lowers your heart rate, reduces stress hormones, and helps bring your blood pressure down. It's like hitting a reset button for your nervous system.
Okay, so between nitric oxide, the vagus nerve, and baroreceptor sensitivity, it's clear there's a lot happening under the hood. But what about results? Can everyone expect their blood pressure to drop by, say, 20 points?
That's a great point, Anna. While some people might see dramatic results like a 20-point drop, others might experience more modest improvements. It really depends on factors like your baseline blood pressure, how consistently you practice, and whether you're combining these techniques with other lifestyle changes, like a healthy diet and regular exercise.
That makes sense. So it's not a magic bullet, but it's definitely a powerful tool in the toolkit.
Yes, and the best part? These techniques don't just lower blood pressure, they also improve your overall stress resilience, emotional well-being, and even cognitive function.
Wow. So you're telling me I could lower my blood pressure and feel calmer and sharper? Sign me up.
That's the idea, Anna, and it's why I think everyone should give these techniques a try.
All right, so far we've learned about some incredible breathing techniques like IMST, Pranayama, and the relaxation response, and how they can lower blood pressure while improving overall well-being. Now, Dr. Reddy, let's talk about how listeners can actually incorporate these practices into their lives. Where's the best place to start?
Well, Anna, the key is to start small and keep it simple. For most people, setting aside just 5 to 10 minutes a day is enough to see benefits. You don't need a perfect environment, just a quiet spot where you can sit comfortably.
Okay, so once you've got your spot, what do? Let's make it super practical.
Sure, here's how you can start incorporating these techniques into your daily routine. First, choose the breathing method that resonates with you. If you like something structured, go for Inspiratory Muscle Strength Training, or IMST, where you can use a handheld device to practice 30 slow, forceful inhalations. But don't worry if you don't have a device. Deep diaphragmatic breathing works just as well. Next, set a timer for 5 minutes. Keep it simple and manageable in the beginning, and as you get more comfortable, you can gradually increase the duration to fit your needs. When practicing, focus on your breath. If you're following the relaxation response, try pairing your breathing with a calming word or mantra like peace or calm to center yourself. If you're exploring pranayama, use techniques like alternate nostril breathing or slow, steady breaths to get started. The most important part is consistency. Aim to practice daily because just like building a muscle, the more consistent you are, the greater the benefits you'll experience over time.
I love that. And what about people who are super busy? I mean, life can get hectic and finding even 5 minutes might feel like a challenge.
Well, for busy people, try integrating these practices into your existing routines. For example, you can do deep breathing while commuting, during a work break, or even lying in bed before sleep. And remember, it doesn't have to be perfect. What matters is showing up.
That's so reassuring. It's like giving yourself permission to just do what you can. And I imagine having tools like apps or guided videos could make it even easier.
Oh yes. There are some great apps out there that guide you through breathing exercises. They can provide structure and even track your progress, which is motivating. And for techniques like IMST, there are specific devices that make it easier to get started.
Okay, so we've got the tools and the plan. But let's talk about the bigger picture. How do these breathing practices fit into an overall strategy for managing blood pressure?
I'm glad you asked that, Anna, and this is very important. Breathing exercises are just one piece of the puzzle. To maximize their benefits, combine them with other healthy habits like eating a balanced diet, think lots of fresh veggies and lean proteins, staying physically active, and managing stress. It's all about synergy.
That's such a powerful concept. And I think it's empowering to know that we have so many tools at our disposal. Speaking of tools, do you have any tips for overcoming common challenges like sticking with the practice?
Sure thing. My biggest tip is to make it enjoyable. If it feels like a chore, you're less likely to stick with it. Find a method that resonates with you, whether it's a calming yoga session, a guided breathing app, or simply sitting in silence with a mantra. And don't forget to celebrate small wins. Even a few minutes of practice can make a difference.
I think that's such an important reminder. All right, Dr. Reddy, as we wrap up, any final thoughts for our listeners?
Just this, small actions can lead to big changes. Breathing is something we all do, but when done intentionally, it can transform not just your blood pressure, but your overall health and well-being. So, start today. 5 minutes can truly make a difference.
That's so inspiring. Well, listeners, that's it for today's episode of Everyday Health Stories. We hope you've learned something valuable and feel inspired to give these breathing techniques a try.
Thanks for joining us today. We'll see you next time with more stories, more science, and more ways to live a healthier life. Take care, everyone. Bye for now.